My name is Robin I'm a cardiologist with the Doctors Clinic. We have offices in Silverdale, Bainbridge Island, and Bremerton. And I'll be talking to you about women and heart disease, specifically the role of gender and how it relates with coronary artery disease. Awareness of CAD is very important for not only the women in the general public, but also for health practitioners, because it's a great big public health problem. Every year there are about 500,000 heart attacks among U.S. women alone, and over 350,000 cardiac deaths. That's a lot of women. That's almost twice the number of women that die from cancer, all causes of cancer, every year. If you ask women what they're most afraid of hearing when they go to the doctor, what diagnosis they're most afraid of being given, most women say cancer, breast cancer in specifics. Of women surveyed, less than 15% identified coronary artery disease as something that is of particular risk for them as an individual. So there's a big disconnect between the burden of disease and the awareness of the disease among the population. Some other reasons why we should be concerned about women in particular with respect to coronary disease is that the risk factors for coronary disease affect women differently than the risk factors affect men. That's not commonly known, I think, in the general population. For example, if you're a woman who's a smoker, your risk is almost twice that of developing a heart attack than that of a man, all other things being equal. And if you're a diabetic woman, for example, your risk of having a heart attack is over 2.5 times greater than that of a man. If you happen to be an obese woman, your risk is over 7 times greater. So cardiac risk factors don't know equal opportunity among gender. It should be stressed that coronary disease, heart attacks in particular, for most patients present in a similar way. Most patients, including most women, present with what we call typical symptoms. Substernal chest pain or pressure, sometimes radiating to the shoulder, the left shoulder in particular, associated with shortness of breath. Symptoms are worse with activity, such as walking around or climbing stairs, and relieved with rest. Those are the common symptoms of a heart attack or blockages in the heart arteries that are going to be causing trouble. But women, more than men, have a disproportionate number of presentations that are atypical. For example, they don't get the chest pain. They might show up with just a little bit of pressure or indigestion, lightheadedness, dizziness, just some problems breathing. And those are things that sometimes are harder to clue in to coronary disease as being their underlying cause. If you yourself start experiencing any of these symptoms, the first thing to do is to call your doctor. If your doctor's unavailable and if your symptoms are severe, you should seek emergency care in the emergency room. Making the diagnosis for women depends upon the setting with which a woman presents. So if it's in the emergency department, it's the standard usual evaluation, an electrocardiogram, a tracing of the heart's electrical activity, measuring blood heart tests. But in the outpatient setting, it's sometimes a bit trickier. For example, routine stress testing is sometimes different for women than it is for men. For example, one of the tests that we often use to diagnose the likelihood of having underlying blockages in the heart arteries is with what's called a standard treadmill stress test. And that test doesn't tend to perform as well for women, for example, as it does for men. If you have undergone a stress test, the next step usually depends upon how that stress test was interpreted and what findings were identified. If it's felt to be a high-risk stress test, then usually the next step is to look at the heart arteries directly with a heart catheterization. The best thing that you can do for yourself is to keep yourself out of my office. And so probably the thing to do is stuff that you already know how to do. Eat well, follow a Mediterranean-style diet that's high in the good types of fats, and have a lot of exercise incorporated into your lifestyle. Even a little bit is better than none. 5 or 10 minutes a day is better than none. but the more you can get, the better. My name's Robin Houck. I'm a cardiologist with a doctor's clinic. My main office is in Silverdale. If you'd like to get in touch with me to further discuss cardiac issues, I'd be happy to talk to you. My office number is 360-830-1601. Choose well.